Bang, here we are. Honorable Tasha Diaz. I call her the Iron Lady of Yonkers, New York. That's how I call her. Tasha plays no games. From the beginning, even before she was elected, she said, I'm not here to please anyone. I'm here to fight for those who elected me. And does that continues to be the case, Tasha?
Yes, it does.
Tasha, but we are, facing a crisis, okay? And I heard on the news today that the Black and the Latino community are being affected by this more than any other group. And you are on a district that you have lots of Blacks and minorities. Does that concern you? And do you have anything to say about that?
Yes, it does really concern me. I have the hardest district, as you know, so I represent the north and the south side of Yonkers. Um, it bothers me because I feel that these people are the most affected because think about it, Rue. These are the people that mostly are on the front lines. Correct me if I'm wrong.
You're
These are
right.
the
You're right.
people that are mostly on the front lines. These are the people that are our bus drivers. These are the people that are our janitors. These are the people that work in food service. These are the people that are essential workers in our supermarkets that have to stock the food and things for us to be able to come in. So these people put themselves on the front line, and many of them live check to check. They don't have they they can't distinguish whether I can or can't go to work today. They have to go to work. So I believe this is why, well, one of the reasons why they are the ones heavily populated with COVID, as well as healthcare issues, as well as living check to check, you know, barely making ends meet. We all know Lysol is going for $8 a can if you can find it.
If you can
So
find it, yeah.
if you can find it. So that right there, it's a lot of things that come into play. A lot of people say it's happening on the South Side because they're hanging out, because they're, that is not the case. That is not always the case. That's an easy answer to say they deserve it or this is why they're getting it because of that. That is not the answer. The answer is many of them are on the front lines.
But Tasha, I have to tell you this. Education is so important, but I don't know how much stuff can you say, you, the president, CDC, the governor, the mayor, or anyone, how much can you say for people to take it serious? We posted a video yesterday from the supermarket shop right here on Riverdale, and you see people in there like nothing is going on. There is a mandate, stay away. So do I need you to tell me, Rue, you shouldn't be in places where there is gathering? No, our people also need to understand the consequences because, Tasha, this is serious,
Yes, it
but
is.
not just serious. This is deadly serious. Like if you
Yes, it
don't
is.
take it serious, you die.
Yes. If I could bring this up, the police department was actually in my building today because we don't play these things in my building.
Mhm.
We're very tight knit family. Everyone here knows everybody. We either grew up here, our parents grew up here. We're very tight knit, and when they realized that it was a bunch of kids coming into the building, going to a particular apartment with and the child's mother has underlying conditions, and this child is not taking it serious that your mother can potentially die because you want to have your friends come over and hang out. And I applaud Yonkers Police Department because they were here. They came six. They came here. They broke up the social gathering and they escorted them out the building. So I commend them on that.
Kids in the field playing basketball, adults by Lincoln Park playing dominoes. I don't know if we are really taking this as serious that we should. I know I am.
Yes,
Okay.
I know I am.
Yeah, I'm not going on the street unless something really big breaks. But even then, I think twice. So we need to take this death, serious in a way that we never took anything before. Now, this is not like a flu like any other flu. Okay, the other flu did not kill 14, almost 15,000 people in 2 weeks
Yes.
or 3 weeks. Now, but you're doing things, Tasha. You are doing things. I have this agenda right here. I don't know if people can see it, but you can talk about it. Let's talk about Point one.
Well, as we stated, I won't get too heavy into it because we're having a
Yes.
meeting about it tonight. But as the laws and the news has stated, it is heavily populated in minority areas. So we came to grips to say before this even came out, we knew. We asked for the breakdown. They were not allowed to give us the breakdown, but yesterday we did receive the numbers by zip code. 10701 is leading, and that's very
10701.
10701. Yes, is leading. They're yesterday last I checked, they were at 500 and something. So they're leading. So myself, I brought the initiative to city council president, and I pitched it to my colleagues like, look, we're heavily populated over here because we have the buildings, we have the density. We need to make sure that the landlords and building owners are doing what they have to do to make sure that people that have to go out to work, that have to go out shopping, that they are leaving in sanitary conditions. Because I've gotten numerous of calls, so did Shanae and so did Mike Cater, about building owners not cleaning at all. I mean, to send a letter around to say, you can't have gatherings, don't have any visitors. If I'm trying to quote exactly what they said, no visitors. And they were told if you visited out of the country, do not enter the building, and 3 people into the laundry room. Okay, how are you enforcing this when the building has 130 plus units? That's just units, 1, 2, and 3 bedrooms. So we're talking about thousands of people. The management themselves have not been to the building. They have not cleaned. They have not done anything. What they are doing, they're pushing papers. So the south side of Yonkers being the most vulnerable, myself, along with my colleagues, felt that this was something that had to be put into play to let the building owners and the landlords know this is a deadly disease.
Mhm.
And a lot of them don't live on the premises, so a lot of them do not know, or sometimes they don't even care. So this is why we brought this to the forefront as far as the disinfecting. The
Uh,
second one, the
go ahead, Tasha. I have a question here, but finish your sentence and we go into the sentence to the question.
okay. Well, and the second part about it was the disinfecting while schools are closed. I spearheaded this, and I wanted them to disinfect. I lived in Yonkers my entire life, Rue. Um, I have a 18-year-old. I have a 22-year-old. I've never in the history heard of any of the equipment that are in the playgrounds being cleaned. If someone has seen it or heard of it, please correct me. But I've been here my whole life, and I've never heard of them disinfecting the parks. So that was one of the things that I said, you know what? Parks are closed. While the children are not supposed to be playing in the parks, this is the time that we are supposed to go in and be proactive. Let's not wait for a child to go into the park after this is all and catch it and respread it. While the city is somewhat closed down, we need to go and disinfect. And
But
my
you know,
colleagues were
Tasha, on the other side, I think data shows that the virus survives on the surface for
mhm,
about 72 hours tops.
right.
Now, if you keep your child away from the park, in your house for now until thing clears up, that child will not be touching anything. So,
Mhm.
and as we go on social media, we are in this together.
Yes.
So, if we are in this together, we as citizens, we as residents of our buildings should take some action
Yes.
to help each other.
Yes.
Don't go out. If you live in your building and your building has 4 families, put some gloves on, put a mask on, maybe disinfect your door,
And that's
the
what I've been doing.
hallway. You
You
know,
could ask the residents in my building. They've seen me, and my security guard as well can let you know that I have been myself, not only my super and my porter, I myself go through the middle of the night, maybe around 12, and I disinfect the laundry area, all of the knobs. I disinfect the elevator. I disinfect the buttons. I go down the stairwells and I disinfect the handles, only to be helpful because I live here.
so
And that's the,
Tasha, why can others follow your example? We are in this together. You're doing it. Why shouldn't the guy next door do it? The guy below you do it? And since we are on this together, let's do everything that we can together to protect us together from being infected by this. Now, Tasha, just hold 1 second. I see somebody here by name of Raymond Marrero.
Mm-hmm.
Raymond, your statement is this. Hello, Ru. I wish some of these people can take a walk in my shoes so they can open their eyes and see that this is serious. What do you mean? Were you infected? Did you recover? What did you mean? Please write and then we come back to you. So, Tasha, that's one of the things. I think it's education. We need to do our part. Okay.
Yes, we
And if we can do the minimum, which is don't go to the park, don't go outside. If we don't do this, much less wiping the doorknobs in our own place.
mm-hmm.
Okay. And that life that you save can be your own.
Yes. But a lot of people nowadays, I'm looking at it, people are being selfish. And there was, I don't have the exact quote from the Bible, but this that we're going through right now is a quote in the Bible. And God wants everybody to come together. He wants everybody to come together and be as one and look out for each other and not go out for themselves. People are being selfish. You know, I adopted a senior through the Office of the Aging. I've been out there shopping for my mom. I have not let my mom leave the building. Um, my husband's mother, we have not let her leave the building other than to go to work and come back. You know, I'm scared for her. My husband's mother is a healthcare worker. She works and she has to go to work. So if I can go out of my house and spray the knobs and spray my security guard's desk, other people should be able to do that as well. And
Yes.
I'm not using it. I'm not using the things from my building. These are things that I bought on my own. Sanitizers. I can show you big jugs of sanitizers that I bought from Sam's Club. And you know, me and my super were he watched me grow up. That's how long I've been here. He watched me grow up. So we have that kind of connection, as well as my building owner. And I
Mhm.
called my building owner up and I said, Eugene, can you put a hand sanitizer station downstairs by the elevator? Do you know, Rue, he didn't even think twice. He had it put up.
That's nice.
These are the kind of landlords that we need.
Correct. But we also need tenants that will take this serious
Hmm.
and say, okay, maybe this is the responsibility of the landlord, but I, as a tenant, also have a certain level of responsibility.
Yes.
Now, this comment from Jay Sabasae. Jay, you're saying that they need to clean up the street. I guess you're not into much of what's going on. They are cleaning up the street. DPW, Yonkers Fire Department, they are going all over Yonkers,
Hmm.
spraying chemicals to kill the germs. But remember this, they are in point A, they disinfecting today, then they go to point B, C, and D. That does not mean that point A will not be infected again in a few days, because there is people walking back and forth all day long. So the germs from that day, yeah, get killed. But what about tomorrow? What about the next day? But the point is, the city, it's doing all that they can to keep us safe. The
Yes.
council body, council president, the mayor, they are doing all that they can. But we as citizens, we need to do our part.
Yes.
We need to
Yes.
do our part. We need to stay home. Okay. We don't need to send our children to the park. What do we need to learn? One of a kid that goes out to the park needs to die from this damn thing, and then we start GoFundMe's and crying because my kid. Be proactive.
Yes. And in the beginning, I was rude. I went out to the most vulnerable, which was the seniors. I packed them along with Jose Alvarado, myself, and Mayor Spano. We provided a bag. Inside of the bag was bleach, Comet with bleach, tissues, toilet paper, and hand soap. So we were proactive. And it's easy for people to point fingers and say, do this, do that, do this, do that. But what people don't realize is as a city, we're only we're limited to but so much we can do. This is when you need to contact your state and your federal officials. People stop right at city. certain things need to go through the state. We can advocate for you as much as we want, or as much as you want us to. But if it's a federal or a state entity that needs to be contacted to get through to whatever you want done, those are the entities that you can contact, and also contact us, and we will help you when you get to those entities. But people are quick to judge and say, Yonkers isn't doing this, Yonkers isn't doing that, Yonkers isn't doing this. Believe it or not, during this pandemic, and we're focusing on disinfecting, we're focusing on, making sure people eat, we're focusing on things like this. I have people that call my office that say there's a hole in the road. And I'm saying, at this time right now, these are things that people are thinking about. People are home right now, and I feel as if they're being kind of selfish because they're nitpicking at every and any little thing that we do. And it's not fair to us, because not only are we out there leading, we have families as well. So when I say the selfishness, that's what that goes back into. People are worried about themselves instead of, like you said, coming together and forming a solution.
Exactly. There is certain things that no one expects residents to do. I don't expect residents to fix their own potholes in front of where they live, because that pothole is not going to kill you. Okay, I don't expect residents to go and clean the streets of Yonkers. We pay taxes for those services, but there is things that we can do. And this crisis, there is a lot that us as citizens can do. We can stay home.
Yes.
We can stop the spread,
Yes.
and we can save lives, okay, by staying home.
Yes.
When you don't do none of that, you are actually exposing and putting those that are working hard to save our lives at risk.
Yes.
Not just them, you might exposing your grandmother at home, your uncle, your parents. Young people do die, okay?
Yes.
But somehow they think that I'm young, I'm not going to catch this. You can. And if you don't, you can contaminate somebody who might die from it. So stay home, guys. And people avoid gathering. What do you think about businesses, Tasha? I think Riverdale, it's your district, isn't it?
No,
ShopRite?
that's Shanae.
That's
Um,
Chanel.
yes. I start further up Riverdale past the police precinct.
But regardless, let's say that ShopRite on Riverdale was your district.
Yes.
What would you do? Because today I passed by, and after they saw the video, they controlling the door. Now there is a big line outside, and they controlling how many people going in after we showed the video yesterday. But dude, come on, do we need to show a video for you to act on it?
We shouldn't have to, but it's sad that in certain areas in this day and age, you do. Because when I went shopping in Sam's Club, that's in Elmsford. They had the police station there. They had us going in one, certain amount of people at a time. Costco, everywhere else was doing it. Greenberg, and then now they're getting down where they're saying that you have to, that they're trying to make sure you get your temperature taken before you come in. They're putting sanitizing machines outside with wipes. They're doing certain things. These are Why is it in more prominent areas? It should be everywhere, regardless of where you live. If I'm going into a supermarket and I'm spending my money and I'm helping the people that are in there with their salaries or whatever the case may be, I think they should kind of look out for the consumer as well. I mean, look out for our safety. We're going in there just as well as they're putting their life on the line to put the food and things on the shelves for us. We're going in there and we're putting ourselves on the line to try to retrieve food for, like I said, I got a senior that I shop for, myself, my mom, my mother-in-law, so we put ourselves on the line when we go into the stores as well. I think that they should cherish the consumer just a little bit more.
I agree with you. But Tasha, at the end of the day, I ask you this question. Whose life is it anyway? It's your life, right?
Yes.
Okay. If I go to a place and I see that there is 100 people inside running from one place to the other, you know what I do? I wouldn't even walk in.
Yeah.
I would go and shop elsewhere.
Mm-hmm.
Okay. I would go and shop elsewhere. And then I would call the law enforcement and say, look, there is a mandate for people to stay home. There is a New York State mandate prohibiting people from gathering.
Right.
This supermarket or this store or this warehouse or whatever it is not complying with the mandate. You need to go in there and take action. People
Not
need
to
to
make
take.
That's true, but not to make an excuse for them. But a lot of them, that's their nearest shopping center.
It doesn't
That's
matter, Tasha.
that,
It's your life.
we understand that, and sometimes I understand that, and me personally, myself, I wouldn't stand for it. But you got people, sometimes they're scared to speak up. It may be their life, but it may be that undocumented person. It may be that person that their English is not good. It may be that person that's just scared, or that person that said, you know what, I need it, let me go do it. Is it right? No. But people do think like that. They
Yeah.
do. They do, because when you go into certain places on the South Side, what I realized is a lot of people are scared to have their opinion, because the minute they open their mouth, if they're not speaking correctly, or they don't know how to pronounce a word, or the person in the store just doesn't want to hear them, they want to call the cops and kick them out, or they want to badmouth them for speaking up. So a lot of people don't speak up for that purpose.
Yeah.
Me myself, I was always taught to say whatever I feel and whatever I feel is right. So I've always had a backbone. So
Mhm.
me, I'm not like that. But you have people that shy away and they get scared. They
Correct.
do.
I know. John, why aren't they cleaning the streets? I think that at this time, in a moment of crisis, cleaning the streets is the least of my worries. I'm talking about wiping, sweeping the street. That's what I'm talking about. And in regards to disinfecting, they are doing. So we have bigger fish right now to worry about. People are dying, so I can deal with a can on the street. I'm not saying it's right, but again, we as community can also help. Don't throw
Hmm.
that can on the street. Don't throw that piece of paper on a sidewalk. Look for the a garbage can and put it in there. I'm not saying pick things from the street because you don't know if the thing is infected or not, but we as people can do something about it. So
Yes.
street is not something that I'm concerned with. Now, as people are chatting, Tacha, let's go into something else on the agenda. Cancellation of reduction of interest and penalties relating to late payments of county taxes by residents, taxpayers of the city of Yonkers. What do you mean? What are you talking about?
Well, that was introduced by City Council President Mike Hader. So he can get more in depth. He's going to get more in depth about that tonight at our meeting. I hope everyone tunes in, because we did do a special. We called a special meeting pertaining to the COVID.
Okay.
Now that everyone's home, I please hope that they take this time, that while you're sitting home, to tune in to City Council, to see what we do, see what we've been working on. Because we have been working behind the scenes on a lot of good resolutions that we're going to put out, and ordinances that we're going to put out tonight.
You're right. A lot of people, Tasha, they complain about this, they complain about that. But then when we say, okay, what are you doing, to find the resolutions for the things that you are complaining? Do you participate in council meetings? Do you go there and voice your opinion and then express what you think? And people don't. So instead of complaining so much, act on it. Act on the
Exactly.
way by participating in meetings, voicing your opinions. So let's go to resolution 3.3. Increase sanitizing of all city-owned equipment in public parks and schoolyards to prevent the transmission of. Well, I think in a way that to me, it's kind of a half mute, because if people are at home, by the time they back on the parks, there will be no contamination. But we lose nothing. Going in there with the spray as they're doing
Hmm.
on the streets,
Yes.
like our president says, what do we have to lose?
Right. And that was actually my resolution that I introduced. And like I said, at City Council, we'll go more in depth, because it doesn't limit schools and playground areas. It actually includes a lot of different places as well. That I just feel like the city is dirty. The city needs to be cleaned.
Yes. Now, we all understand that you are a councilwoman and you represent a particular district, but you are also a Yonkers resident. And
Exactly.
what affects people, councilmen or regular people from other districts that we don't live in, this is still our city.
Mm-hmm.
It still concerns me, regardless if I'm directly affected by it or if I'm not. It's still my city.
Exactly.
So let me ask you this question from J Job. And the reason why I'm asking is because I know this question, really, you have not much to do with it. But you, as a Yonkers resident and taxpayer, unless as a councilwoman, are you exempt from paying taxes?
Oh no, I still have to pay taxes.
Okay, then this is your city. Then this is your city. Why are schools open for meals, close all schools and open community centers for food, Yonkers boards? I guess you understand what she's saying. What she's saying is, if schools are closed, why are you there to give food? Well, I think if schools are closed, then the school is just a building as any community center. So,
Exactly.
so it's the same thing, right?
It is. And with a community center, you actually have to walk in. This the way they distribute the lunch is somewhat of a grab and go. So we're making sure that the children are still provided with what they need while they're at a school. We're making sure that they're still provided with a breakfast and a lunch. I mean, like I said, it's easy for people to point the finger and say, close the schools, open up the community centers. But then with the social distancing, how are you gonna do that if you open up a community center to do that? Now
Exactly.
you're contaminating a community center and you're bringing a large amount of bodies into a community. I mean, people are quick to say, do this, do that, do this. When you're not sitting in this seat
Wearing
and
those
having,
shoes,
yes, and having to think for thousands of people, because you always have to play devil's advocate. When you put something in play, whether it's a resolution or ordinance or a suggestion, you always have to play devil's advocate and say, what if, what if, what if, what if. So when people blurt out and say, close all of the schools, how are the children going to get fed? How are we going to
correct,
feed them?
correct.
Are they able to go to community centers? Because the only community centers I know of is the Peter Chima Center and the Neppahan Community Center. So the schools are scattered throughout
No,
Yonkers.
no, no. We have others. We have Yonkers Portuguese Center, which is also a community center.
But
We,
that we
we
well, let me correct it, that we utilize on a
well,
regular.
let's utilize the others. You see, those other community centers, they get tax brackets, discounts. They get grants to serve the community. So let's use them to serve the community.
But we're
But
trying
I
to limit
understand you. But I understand your
we're
point, and
trying
it's
to
valid.
limit the spread. We're trying to
Yes,
limit the spread because in a community center is open, is wide, as
yes.
opposed to in a school, being that children are there and it's kind of like a security like type setting. So it's better to just grab and go as opposed to going into a community center.
No, I
Because
got you.
now, yeah, because now we're risking spreading it throughout an entire community. Because God forbid someone goes into that community center or the person in that community center is not cleaning that center for that amount of traffic, someone can get sick.
No, I
I mean,
got you. If we already have community centers that can do the job, why
yes,
infecting other community centers that don't need to be infected? Let's
exactly.
utilize. If it comes time that those other community centers are needed, then we will cross that bridge once we get there. Now, before we go further, there is a question there for Alma Lopez. Alma, let's use a little of logic here.
Please.
The city is doing all that they can. They are disinfecting the cities, but that doesn't happen overnight. It takes time. Maybe today they do a certain amount of
Hmm.
blocks, then tomorrow they do different blocks, and chances are some blocks will be missing. Okay, I'm not sure that they're going to do 100% of every single city block, bus stop in the city of Yonkers, but they are doing all that they can to minimize it. So we have to deal with it. It's just like snow time. Okay, sometimes you say, oh, they didn't clean my street. Look, they clean most of the streets that they possibly can. Are they
Exactly.
going to hit every single street in Yonkers? No.
Right. And I want to bring this to people's attention because everybody keeps saying clean the streets, disinfect the streets. I understand them saying disinfect the streets, but what we're focusing on right now are the buildings that people are having to utilize to go inside to get your food, to go into the bodegas, to go in and out of their apartments. We walk on the street. We walk into these things and touch things. So what would you prefer to be done first? The streets or the buildings that we're utilizing?
Correct.
I mean, you got to put one before the other.
Yep. Now, Tasha, there is a group of people that I call the forgotten ones. Council people, Mr. Rubo the other day told me they're not a forgotten band. Well, I think they are. Okay. That's my opinion. Of course, he can have his, and I respect it. You can have yours. Other people can respect theirs. Can have theirs. But to me, they are forgotten.
There is a population of people that are forgotten.
Yes.
And it's different populations, whether it be the immigrant population, whether it be the undocumented population, whether it be the minority population. There are different populations that are left out of certain things that are forgotten.
So I don't see much talk about it. And I think that, it's like we're not talking much about the prison, the infections in prison. We are not talking about the homeless population that live in shelters. And we know that this virus is highly contagious.
Yes, it is.
And I know for a fact that some homeless have tested positive. And if they tested positive and they're going back to the shelter, guess what's going to happen? If we are telling people stay home, and for those homeless people, home is the shelter, and in that shelter you have 100 homeless people that will come out of the shelter and talk to other people and walk into those stores that we might walk in right after them.
Right.
How are we going to stop this thing from going around?
That's why we were focusing on them disinfecting the buildings, like you said. They're going in and out. We wanted them to disinfect the park benches because we all know sometimes they utilize the park benches as well. People spit, urinate, defecate, vomit, do different things in the parks. So that was one of the things that we put into play. We wanted the parks disinfected as well, because people go in and out, the stores, the things like that. These are the things, the buildings that you go in, you touch the knobs, you touch the door to get in and out. These are the things that we are focusing on now. So when people say clean the streets, we will get to the streets, but people walk the streets. We're trying to get to the buildings and things that you utilize on a daily basis.
Correct. Now, there is a comment here from Bart. Do you think staying home will eradicate? What happens if one person still has it next year? Well, Bart, no one talking about eradication. We talk about minimizing. Okay.
Yes.
Maybe in the next few months we will have a vaccine that will address this issue. So right now the advice is stay at home. And as you see, staying at home, social distancing has
flattened the curve. Yes.
Flattened the curve.
Yes.
So continue to do it. In the meantime, let's hope a vaccine is it's quickly approved and we can just go on and kind of cutting this thing out. Will somebody else die in the future? I'm sure. But we need to minimize the spreading of this disease. No one is talking about eradicating it at this time.
What people need to realize is things don't happen overnight, bro. And everybody's in an uproar because everybody's home, sitting home. Everybody's bored. They're watching the same thing. They're on Facebook. They're on it. So, like I stated in the beginning, it's quick to say, do this, do that, do this. It's quick to say that. But government doesn't work like that. And the only way to get what you need through government is to advocate. And I've been advocating for the people, not only for my district, but for the entire city of Yonkers. I'm a lifelong Yonkers resident. So when I go out and I advocate, Rue, I don't see districts. I see my city, the city I grew up in, the city that I love, the city that I am now representing. That's what I see when I go out.
Mm-hmm. Cassandra says, I'm scared to go there, meaning the supermarket.
Yes.
Excuse me?
I said, yes, I totally understand.
Yeah, I'm scared to go there to the supermarket after I saw the video. Well, we don't want to hurt any businesses. And I think that business should also make responsible decisions.
Yes.
I also think that we don't need to publish a video where it shows hundreds of people inside the business and probably exposing others. That video does not need to be exposed in order for businesses to take action and not allow that in their own stores. So, Cassandra, we passed by the store earlier today. There was not too many people out there. They were controlling the amount of people that came in based on how many people went out. So, is it safe? I don't know. But they seem to be doing something about it to avoid many people. Now, is the stuff inside the store contaminated? I don't know. But I don't know either if it's possible not to have some stuff contaminated, because people go to the supermarket, they pick up this can, they look around, they put it back on. So follow the instructions. Whatever you take home,
You spray down.
exactly, before
That's
you
what I
use
do.
it, yeah, before you use it, spray it down.
My
Clean
bags,
your
everything.
bags, clean it
Anything.
up. Yeah. When you go to the store, take your own bags with you. Okay, because those bags there, okay, we don't know who touched them. And I'm
Exactly.
sure that most of us are not going to disinfect a bag when you come home. But if that bag is contaminated and you touch something that you already wiped out, guess what? That is going to be contaminated. So take your own bag there.
I have teenagers in my home, so I'm on top of them all the time. My kids think I'm crazy because before they come in the house, I spray them down. I spray their shoes because you can bring that into your home on your shoes. I don't let them touch anything until they come in after being sprayed. Wash their hands. Not only that, a lot of people don't know my
Mhm.
baby is 18, but my cousin is an essential worker. So I've had my cousin here with me since school has been out. Why? Because my cousin is so scared that she is going to spread this to her child, that she has not been able to touch her child in the last past 3.5 weeks because she's been here with me, because my cousin works in the healthcare field and she's in and out and she doesn't want to contaminate her child. That has to be something hard for a parent to choose to say, should I leave my child here or should I bring my child home? So me and my cousin, we have that understanding. So while doing all of this for the city and my immediate family, I am also homeschooling a 6-year-old.
Yeah.
So, and I understand everyone's frustration and pain when it comes down to the schooling. I have my secretary looking in to see how we can try to alleviate some of the pain with the Wi-Fi, with them not having like certain things that they need for school. So we've been looking into that. I don't want to make anybody any promises, but we've been looking into certain avenues to try to help alleviate what's going on.
Mhm. So let's take this opportunity, Tasha, to give a shout out to all the medical,
Yes.
personnel, nurses, doctors, hourly, cooks, cleaners, janitors,
Bus
everyone,
drivers, the
bus
bus drivers,
drivers,
the
police
train
officers,
operators.
fire department personnel, EMS, the Empress EMS,
Yes.
every single one that have to be on the street. There is some of us that we don't have to, okay? But there is some people that took a note to serve and protect us.
Yes.
And even though their lives are at risk, they're still out there serving and protecting us.
Yes, they are.
Okay, so let's give a shout out and let's say that we thank them. Now, I know that very often we criticize them for certain things that they do we don't like, but hey, guys, let's give it credit when credit is due. Let's also say thank you for what they are doing for the entire city, for the entire nation. Okay, thank you all for doing what you do.
And I want to send prayers out to the people that are dealing with the COVID-19 right now. I know a couple of people on my Latino side of the family, on my Hispanic side of the family, that are dealing with this right now. My prayers are going out to them. Um, I also want to send out prayers to Sully, which is the mayor's right hand. Please pray for him, and make sure that he has a speedy recovery and all is well with him. He's a good guy. He's a lovable person. He's well loved in the community. I just ask everyone, please extend your prayers out for him and extend your prayers out for my family members as well, and extend out prayers for anyone that has a family member or anyone that is actually going through this pandemic right now.
So let's take this opportunity to send good wishes to my good friend, sister, Lorraine Lopez,
Yes.
who is not feeling well. She's been contaminated by this virus, but I know the lady. I know her. I know she's a tough cookie, strong cookie, and she's going to come out of this and be stronger than ever before. So we send you our best wishes and everyone that is in the
Lorraine,
hospital.
Lorraine is good.
Lorraine is good. I'm talking about her sister.
Yes, that's that. Yes, when I said my other side of my Hispanic,
Oh,
that's
okay.
yes, that's who I was referring to.
Oh,
Yes,
okay. I did not know what you were referring to.
yes.
So I just
Lorraine,
looked.
I love you. I know you're watching. I love you, Susie. I love you, Uncle Hector. I love you
Nah,
guys.
I
We're gonna
ban.
be strong. We're gonna
I,
get through this.
I ban Lorraine. I ban her. From the page. She's no longer with Yonkers Voice.
No, you would never.
I would never do
You would
that.
never.
No, I'm just kidding.
Of course.
In a few minutes, this phone's gonna start ringing. No,
And
I
I
wouldn't.
also want to I want to send a special prayer out as well to my father-in-law. He's also battling it. He's at the tail end of it right now. Um, he's a bus driver. Um, and I just want to say, Orlando, hang in there. The family has been sending prayers. I have not been able to see him for the past couple of weeks, but I wish him the best. And once this is all over, we'll get back together again as a family.
The city, once this thing is put under control, the city should organize a big event in one of these big parks to say, look, we
We
are,
are.
or no, all of us were on this together.
It's
We,
already in the making. It's already in
oh,
the works, and you know me, I'm spearheading it.
you go. There you go. So when you're ready to make that announcement, because we have to celebrate this together. We were on this together, and we need to celebrate the victory of this together. Okay. Now, there is a question from Cicely Greaves. Can you read the question on the display, Tasha?
It says, is it necessary for the city to be cleaned? Where I live in Dutchess County, they cleaned the streets from 9 a.m. until 2 p.m. yesterday, and I can't see the rest of it.
Okay, until 2 p.m. yesterday, and they came down my blocks 4 times. Well, Cicely, this is municipality by municipality.
Yes.
Maybe there is municipalities that they have the resources that will allow them to do that. Maybe they were not hit as bad as Yonkers was. Maybe we have a lot of people on DPW. I'm not saying that we do or we don't. I'm just giving you food for thought. Maybe there is a lot of people that was hit in the DPW and they have to control the crew and use the crew for the essential work that needs to be done.
Yes.
That's what I'm thinking. Okay, maybe a country that has maybe 20,000 residents maybe was not affected as bad, and they can do the pickup, the cleaning as they always did with not much of a big deal. That's what I'm thinking.
And yes, I want to send a big thank you to our DPW workers. They're on the front line, our garbage people. These are people that have to go out to work because our garbage and things have to be picked up. So I want to send a special thank you to them as well.
Well, Carolina Amor, a lot of businesses in Yonkers are not following directions with the 6 feet, 6 feet apart. How can they fix that? Well,
That's when you call your local police department.
exactly. So, Carolina, you have part of the solution. You can call your local police department and just say what you just told us. You need to go to this store. They are not complying, and by not complying, they put in the life of others at risk.
Yeah.
So that's what you can do.
And the police are following up because I did see them. Like I said, they broke up a social
They
gathering.
sure
So
are.
they are following up.
But also let's keep in mind that police department are not babysitters.
Like,
Yeah, they cannot see everything, everywhere. Okay, if they pass by and they see it, they will act on it. But if there is a party going on, if there is a basketball going on somewhere, if there is a store breaking the mandate, then you as a citizen call the
yes.
Yonkers Police Department and report. Now, some folks ask me, well, instead of you filming, why don't you report to call the police department? Well, guys, I'm a reporter. Okay, I report the news. I don't make the news. I'm not here to see wrongdoings and call the police. You can. Me as a reporter, I don't want to interfere. Okay, in calling, if it's something serious that I feel like somebody's in danger, yes, I would call the
Mhm.
police right away. But if it's something that I say, well, maybe I should not get involved, because there is lots of people around that can call. I don't want to be part of the news. I want just to report the news.
Exactly. But everyone needs to do their part. This goes back to the point in the finger. Everyone, you see something, you say something. Period. And it's not about snitching. It's not about calling the police to get people in trouble. It's about saving lives. You have to look at it in a different perspective.
Yeah,
By you making that phone call, you can save a life or two.
yeah. Bart, I have no interest whatsoever in avoiding your questions. And if I'm not mistaken, we already answered one of or two of your questions. See, I'm not an elected official. Tasha is. And Tasha is not picking up the questions to answer. I am. So there is no interest whatsoever in avoiding your question. So there is a lot of comments going on, and I'm browsing through the comments. Is it possible that maybe one of your comments passed by before I had a chance to look? So try asking the question again, and I make sure I pick on that, okay? So let's go to Tasha. Just let's keep talking, as the questions come in. You have point 4 on the agenda.
Yes.
Resolution, mobile testing centers for COVID-19 in the city of Yonkers. Before you answer that question, let me just say this. The city of Yonkers donated a whole bunch of I-95s to the St. John's Hospital. I cannot confirm this, but this is what I hear. Not as many to St. Joseph's Hospital, even though St. Joseph's Hospital has more people contaminated by this virus than St. Joseph's. Why? Do you know?
No, actually, I don't know. I wasn't involved with when they got the donations and when they were distributed. I distributed masks myself, but those were masks that myself and my mom made.
Mm-hmm.
So I can't answer that. But the testing site, that was Shanae Williams. She's the one that spearheaded that one. Um, t- and she did that because we kind of knew where the clusters were. We kept asking for numbers, asking for numbers. Is only a certain amount of information they can give you because of HIPAA laws. But we kind of knew. So once the numbers started rolling in, Shanae knew. We all got together and Shanae was like, Tasha and Kater, and I think we should do this. I think we need a testing site. So Shanae spearheaded that, and I congratulate her on that for taking the lead on that.
Okay. Now, why do we have a testing center at St. Joseph's and not one at St. John's? Is there any reason that you might know? I don't. It
No,
has anything to do with demographics.
I don't know for sure, but when the numbers rolled in, like I said, through zip code, 10701 was the highest. I don't have the actual chart right in front of me right now, but 10701 was leading. And then I believe 10705 came in. I'm not sure on that, but I know 10701 is the leading when they gave us the breakdown of the chart.
Mhm.
So with the breakdown of the chart, that already lets us know when they put the testing site here, they already knew where the numbers were. They just didn't disclose them.
Mhm.
Because you're not going to put up a testing site somewhere that you don't feel is needed.
Exactly. Studies are done before things are done. Now, Tasha, a question that everyone is avoiding to give us, and since I call you the Iron Lady, there is no holding back in Tasha. Is that still stands true, Tasha?
Bring it on.
How many deaths in the city of Yonkers? Because they've been telling me, the Westchester County medical, they're not giving us the numbers. That's
Oh, no,
baloney.
no, no, no,
They
no. I
know the
can
numbers.
I can get you the last
Deaths. I'm talking about
reported.
deaths, not positive results. How
No, the
many
last
deaths?
reported death.
Yes,
Yes, I can pull that up for you and get that
please.
for you. Yes.
Okay. Or maybe your aide can look at it and give it to us. We need to know how many deaths in Yonkers. We need to know another thing that I would like to know. Of course, we're not asking for names. We are not asking for precise addresses of where these people lived. But we want to know how many deaths have happened in Yonkers, reported deaths. We want to know where those deaths have occurred. Because look, if we have, this is just an example. This number is not correct. I'm just pulling this number. If there is 100 deaths in Yonkers, and 75 of those deaths happen in the southwest of Yonkers, that tells me something.
Right. They're not giving us the actual amount of, people that died, but I do have a breakdown. Okay, as of Wednesday, this was the last report that I received. There was a total of 1,915 cases in total reported as of Wednesday, 4/8 at 5:12 p.m. 10701 is leading with 541 cases.
But I'm not asking for cases, Tasha. I'm asking for deaths.
They never gave us the deaths. They never gave us the deaths. We asked for that, and we asked for where the clusters were. We were told that they are not allowed to give us that. The only people that have that would be the first responders. Well, not actual deaths. They will have where it is, because per se they have to go into that building or that area. First responders, meaning police and fire, they would know.
Well, I think all that they will know is there is a positive case, or there was a
In that,
positive case in this building, but not
yes,
necessarily if the
not the
person is
person.
deceased. Yes.
No. So as of now, we haven't gotten any deceased. They only gave us, when we asked for a breakdown, the breakdown that they gave us was by zip code and how many people. So that I can share with you through zip code how many people have been affected, but death wise, they have not.
So you said earlier 10701 has been the zip code where most affected people have been. So I think it would be fair to assume that the place where most of the people have been affected, it's also the zip code where most of the deaths has happened. It
Yeah.
doesn't, right?
Yeah.
It's a
Well,
fairly assumption.
yes, I can give you a breakdown. So 10701 was 541. Okay.
Half,
10705,
almost half of it, or a little bit, yeah, almost half of the cases.
10705 is 364. 10704 came in at 352. The next one was 10710, which was 274. Now, lower numbers. These are where the numbers drop. 10707 is 30.
Wow.
10708 is 98. And 10583 is 29. So we all know South Yonkers consists of 10701 and 10705 predominantly. We have other zip codes, but those are the heavy.
Yeah,
So if you look at 10701, we're leading
yeah.
541, and then 10705 is 364,
But also because,
which is right next to each other.
yeah, but also that's because most people, residents of Yonkers, mostly live in those areas. There is more people in 10701
Mm-hmm.
than in 10710.
Yes, we have the
So
buildings,
the
basically,
building, you know,
the
whatever,
density.
yeah, the density, it's much larger on southwest than in East Yonkers, all the way up down. So it's expected that the numbers would be greater. So,
Yes,
and it's also expected that if the numbers are graded, the amount of deaths are greater. So it
yes,
one that's an equation. Now, this has nothing to do with you, Tasha, but since we have an open forum and people ask, sometimes a question might trigger an answer from another member that might help it. Does anyone know what to do about unemployment? I've been trying 2 weeks to get through because they said I need to speak with the rep and never got back to me. Well, guys, I have heard this from many people. Remember, with the amount of people that
calling.
got laid off, with the amount of people that now are home, there is an overload on the internet and there is an overload on the servers that they
Yes,
are not able to handle the amount of traffic that it's going through. So chances are you're trying to go to the unemployment site and you get an error, and or you get a message, try later. It's happening now. Will
But
they?
the state did say they will go back to when you lost your job,
Okay.
not when you actually got through to the system.
There you go. So you got, you
So,
see, you got the answer. So,
yes.
and that's expected because people are not able to get in. Look, I had a trip to Mexico tomorrow.
Mhm.
I would leave tomorrow. I come back in 2 weeks later. I had to cancel my trip. Well, I didn't have to cancel. They canceled it for me. So with cheapo air, and I send them a form saying, "Look, I'm not canceling, but I'm not going because borders are closed.
Mhm.
And even if they were not closed, I would not want to take a chance of going, not being able to come back. So the airlines are canceling. So I want credit. They gave me the craziest answer. Well, okay, thank you for canceling, blah, 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 but we have to charge you a fee of a certain amount for the cancellation. I said, I didn't cancel. You guys canceled on
Cancel.
me.
Yes.
It's not like I called and said, I want to cancel because I don't want to go. No, you canceled on me. There is no flights. Borders are closed.
Mhm.
This is a crisis. So why are you penalizing me for not going to a trip that is no longer valid, that doesn't exist? You should swallow your losses or get a piece of this $2 trillion. Yeah. So there is a
Mhm.
lot of things going on, but we have to understand that in the middle of everything that's going on, a penalty fee of $20 or $70, it's really not the biggest problem. So let's see what else we have here. Tasha, continue to talk. Talk to the people. They're watching you. We have a good feedback here.
I just want to let the city residents know that I know everybody's scared. I'm scared. We're all scared. But you know what? We're in this together. We will overcome. Yonkers is strong. And I feel like is if we all get together and band together and stop with the finger pointing and who's doing what and who's not doing what, I think if we all just band together and just help, we can overcome this. We can get through this, and we will get through this.
This message comes from Lori Eugenio. We need the vets because the larger number are homeless. Well, maybe Mr. Latimer is protecting us from the truth. Maybe he's using uh, President Trump's theory of the cheerleader kind of stuff. You don't want to tell us the whole truth for us not to panic. But I'm one of those that believe that we need to know how many people have passed due to this thing.
Mhm.
What do you think, Tasha? Do we need
Of
to know?
course. Of course. My whole thing is you have to be honest with people. There's no way, I mean, and I'm not saying that he's not being honest because I don't know if they're releasing that information to him. But when I ran on honesty. I ran on letting people know. If I know, you're gonna know. I can't tell you what I don't know. So if I know something and I feel like it's crucial and it needs to be out to the public, of course I'll let them know. So I think that if it's out there, the people should be known. If it's not out there, if they're not releasing it, there's nothing we can do about it.
Hi, Laurie Cipriano. Nice to see you logging in. Haven't seen
Hello.
you in many years. You don't know her, but sweet person. I know her. And
That is my Aunt Lori. Of course I know her.
Laurie? No, that's not Laurie, your aunt. This is Laurie Cipriano.
Oh, I see a Lorraine Lopez that asked a question.
Oh, Lorraine? No, no, that's the question. I'm just saying Laurie said hello. Yes. Answer Lorraine's, please.
It
I don't know
says
if
this
it's a question or a statement.
it says the state is revamping the system tonight. After 7 p.m., there will be a new system in place for unemployment.
There you go. Lorraine knows everything. Thank you, Lorraine.
My
Thank
Aunt
you for
Lorraine, former councilwoman.
that's it. Honorable
Yep.
Lorraine
Honorable.
Lopez. And,
Yes.
and she's the one who told me, Rue, when you talk about a council person, you have to write honorable first.
Yes.
So because she told me that, the only one I write honorable is Tasha.
Oh, thank you. And Lorraine, I'm glad she moved back to Yonkers because she's a big asset.
Yes, definitely, definitely. Once in a while we get in our crash, but I love her. That's
We all
okay.
love her.
Yeah, when we crashed each other, I leave it alone for about 4 or 5 days. then we connect again. Let's see. They keep insisting. Lorraine Eugenio. Tasha does not know the number of deaths. She knows the number of cases breaking down into zip codes, but they don't know the exact number of deaths. We know there have been a few, okay,
We do that.
but
We know that.
but we don't know how many exactly. Where
We
they
know
are.
we flattening the curve. We know that the deaths that are people that are already admitted in the hospital. So we
Yeah,
do know that they're not any newer cases
yeah.
that we know of.
And remember that there is lots of people that are infected but are at home. Okay.
Hmm.
And another thing that I want to bring it up to you guys is the fact that you take the test. Let's say you take the test today. That result with the test that we currently have. I'm not talking about the rapid test that in 15 minutes you have the result. If you take the test that people have been taking up to now, and you take the test today, the result comes in about 7 days, 7 to 9 days, if I'm not mistaken. When that result comes up, it could say negative or it can say positive. If it says negative, that does not mean that you don't have the infection when you get your report. It means that you were negative at the time
Hmm.
that you were tested. So don't take it for granted. I'm not infected. I can touch, I can talk, I can go, I can see this. No, it means you were not infected when you took the test. That does not mean that you were not infected afterwards.
Hmm.
In other words, continue to take the precautions necessary. Am I correct on that, Tasha?
And as you should, yes, you have to take the necessary precautions. Like I said, my mom lives right downstairs. I don't see her as frequently because I'm scared. Because I do go out and I do assist people. The worst fear in the world is for me to contract it and bring that home to my mom
You're right.
that has underlying conditions and she's a senior and disabled. These are all of the things that stick into my head. She'll say, "Come downstairs, come," and I'm like, "No, meet me at the door. No, I'll drop it at the door." I'm the one that's saying don't enter. She's saying come in, come and see me. And I'm like, Mom, you have to call me on FaceTime.
That's right.
Even with my kids, I have teenagers. They go in and out. They go, my daughter, when she was working, now they closed her job, but when she was working and my son was going back and forth to school, I was telling them, no, you cannot go down there and see my mom as frequently as you would like to. Because I
Exactly.
was scared.
Exactly. Look, I spoke with the council president a few days ago, Mike Cater, the council president, and I said, "How's your mom doing? Have you seen your mom?" And he said, "No, we see each other on FaceTime or
Hmm.
I call her. It's been hard because I have to stay away from her, but we cannot have physical contact at this time. We all know that you love your parents. We all know that your parents love you, but the well-being and the life of your parents are very important. So take no chances, because even though you might have no symptoms of the infection at this time, does not mean that you're not."
Exactly. Exactly. And that's what people fail to realize. When I was seeing the teenagers, I would get out the car and I would go over to them and I'm saying, if you don't want to think about yourself, think about the person you're going home to, your grandmother that you're living with, your aunt that has took you in, your uncle that you're staying with, or if you have a house full of relatives that are over a certain age. When you're outside on the corner and you're smoking that cigarette and you're handing it to your buddy, when you're sitting on that crate or you're leaning up against that metal on the store and you go home and you don't properly sanitize and you hug your grandmother or you sit on her bed or you kiss your aunt or vice versa, anything could happen. Do you want to be the one to bring that home? Will you be able to live with that? After I said that, corner's been clear.
That's it. Guys, we've been on for 1 hour. As my good friend Donald Trump always says, this has been the most beautiful interview, the
Thank you.
greatest interview we ever had. There is no better person than Tasha. She's a great councilwoman.
Thank you.
So Tasha, thank you very much. Thank you very
Thank you.
much for taking the time. to be here with us to talk to the people of Yonkers. Good advice, regardless if you live on 1st District, 2nd, 3rd, 4th, or 5th. We all residents of Yonkers.
Yes, we are.
And I could be a resident of 10701, but tomorrow I might go to a store in 10710 or 5 or 6 or whatever. And this virus does not care if you're white, if you're black, if you live in 1701 or if you live on 10702 or 3 or 4 or 5. It couldn't care less. Okay, that's a virus that it's not biased at all.
No, it's not.
It's not biased. It hits anybody. Okay, so we are the one that have this common enemy, and we have to do everything that we can to minimize the impact of it. Enough people have died, enough people in the hospitals, enough people at home sick.
Yes.
So take all the precaution, right, Tasha?
Yes, you have to take all the necessary precautions. And please, if you have a senior that is a neighbor and that person can't get out, when you go out, please try to think of that senior. Please. Or if you have someone in your building that is disabled that cannot get out, either call the proper authorities to see if we can get them some food, or if you're going out, please try to pick up something for them.
Yes.
Think about your seniors, please.
And Tasha, in closure, let's give a piece of advice, a little chat, a little talk with the blacks, minorities in our city. They've been affected by this. Please be careful. Please avoid gatherings. Please disinfect your hands. Please don't go to stores where you see a lot of people. This is no joke. This is serious, and I would say deadly serious.
It's a matter of life or death. That one decision you make can determine whether you live or you die or you infect someone else.
On that note, we thank you all for watching. We thank you all for participating, and we thank Honorable Tasha Diaz. You see, I use that word again. Say Honorable Tasha Diaz for taking the time to sit with us, and for this 1 minute with Tasha Diaz. 1 minute is a figure of speech. Is actually 1 hour with Tasha Diaz. Thank you,
And
Tasha.
tell them to tune in 4 o'clock for our special meeting, Yonkers City Council.
You tell them, Tasha. You tell them.
Yes. Please make sure you tune in to our special meeting. We've called this special meeting especially to address COVID-19 issues. So please, if you're home, log on, listen, tune in, send in some questions. You can watch it live on channel 78 on cable, or you can go on Facebook Live.
Tasha, since you mentioned that, if I wanted to ask a question, would the question be addressed immediately, or it's a question that you take an answer later on?
I believe Cater being at his live, you can if you go on the Facebook Live, you should be able to send your questions in through there. But you can also call the clerk's office and send in your question ahead of time if you have a question to ask.
What do you mean by ahead of time? Before the meeting itself?
Yes, so that way when it starts, if there's any questions or anything, he will address that to say, look, I got a call and they wanted to know this, or this. So we'll be able to address it.
So guys, it's 2:31 p.m. The meeting goes on at 4 o'clock. If you have questions, do you have that number? You have
the city clerks, or they can call Yonkers, the 377-6300 hotline, and just press the prompts to go to the city clerk.
City clerk. So
city
guys,
office.
It's 2:30 p.m. You have an hour and a half. If you have questions in regards to that, in regards to COVID-19, general questions or whatever you have, call now. Call now, record your question, and then watch live, and you can hear them addressing your question and giving the answer that you are. So watching it live, it's good. You can be aware of what's going on, but nothing like sitting right there and watching and perhaps ask your question right there. Of course, questions have to be submitted before. You cannot just go there and talk whatever you want. It has to be logged in and put on record. Thank you, Tasha.
Thank you for having me.
Until next time.
Thank you.